You know, in medicine, some of the most reassuring signs, they can actually be the most dangerous. Think about it. A steady pulse in an injured leg. That feels like a green light, right? A sign that everything's okay. But what if that vital sign is lying to you? So let's dive into this incredible medical mystery where listening to the blood, not just feeling for it, ended up saving a patient's leg.
All right, let's just get this out of the way right up front because it's a huge one. A palpable pulse does not equal an intact artery. I mean, just because you can feel that little thump, it absolutely does not guarantee that the artery is okay. This one idea, it flips a fundamental assumption in trauma care right on its head. And we're about to see exactly why.
So to really see how this plays out, in the real world, let's follow a case. It starts with a scene that ERs see all the time, a motorcycle crash. But this one had a hidden twist that was seriously threatening the patient's leg.
Okay, so our patient. He's a 28-year-old guy, totally healthy before he gets into a really bad motorcycle crash. He shows up with what looks like a pretty standard, a severe but standard injury, a broken shin bone, the tibia. It's swollen, it's tender, but, and this is key, the skin isn't broken. So on the surface, this just looks like a textbook fracture.
And right here, this is where things get super interesting. The team does the standard check, right? They feel for the pulses in the foot, and yep, they're there, both of them. The skin's color is good, it's warm, no signs of some big bleed inside. So by all the classic measures, the blood supply to that foot looks totally fine. You'd think, phew, okay, we're good, right?
But hold on. That sigh of relief, it might be a little premature. See, experienced doctors know that a serious injury doesn't always announce itself with screaming sirens. Sometimes it just whispers. And that's where we have to get into the huge difference between what are called hard signs and soft signs of an artery injury.
And in this guy's case, oh yeah, the whispers were definitely there, if you knew what to listen for. So while you could feel the pulse, it just felt weaker than the pulse in his good leg. Plus, the patient was complaining about this deep, intense pain that seemed way out of proportion for just a broken bone. And on top of all that, the crash itself was so high energy, that alone is a massive red flag. These are the whispers.
So what's the actual difference? Well, hard signs are the ones you just can't ignore. We're talking active, pumping blood, a rapidly swelling leg, or just no pulse at all. They're screaming emergency and you have to act now. But our patient? He had the soft signs. That weaker pulse on one side, that crazy pain. These are the hidden threats. They don't give you a nice, clean answer, but they are a huge warning sign that you absolutely have to dig deeper.
And this puts the whole team at a real crossroads. I mean, the patient looks stable, the classic signs are all pretty reassuring, but those nagging little clues, those soft signs are really worrying. So what do you do? What's the next step when you need to investigate, but you don't want to jump straight to some big invasive procedure?
The answer is sound. Yeah, literally. A Doppler ultrasound. This little device is basically the hero of our story. It's this amazing, non-invasive way to go beyond just feeling a pulse and to actually listen to the quality of the blood flowing through that artery.
And look, this isn't some huge machine down in a radiology department in the basement. We're talking about POCUS, point-of-care ultrasound. It's a handheld, portable device that lets doctors get these incredible diagnostic pictures right there, at the bedside, in minutes, no waiting. It's been a total game changer for emergency medicine for sure.
So how do they do it? Well, the process is pretty systematic. The doc uses a specific kind of probe and they start above the fracture. Why? To get a baseline, to see what normal blood flow looks like for this specific patient. Then they slowly scan down past the injury site. And the most important step of all, you always compare it to the uninjured leg. That healthy leg is your control group, your gold standard for what's normal.
All right, so the probe is on the leg. They're getting a signal. What are they actually looking for? This is really the climax of the whole investigation. It's not just about seeing that blood is moving. It's about listening to and interpreting the story that the sound waves are telling.
And here's the key idea. The Doppler machine takes the sound of the blood flowing and turns it into a picture, a graph, that we call a waveform. And the shape of that wave, man, that tells you everything you need to know about how healthy the artery is upstream from where you're looking.
Okay, so let's look at what good looks like. In a healthy artery, you get this really sharp three-part signal. It's called a triphasic waveform. You can see it right there. That quick spike up, a quick dip down below the line, and then another little bounce back up. That thump, thump, thump look, That's the signature of a perfectly clear, open pipe. Blood is just flowing through beautifully.
But now, look what happens when there's a problem. If there's a blockage or an injury, it acts like a muffler on that sharp signal. So downstream, that crisp three-part wave just gets totally blunted. It turns into this slow, rounded, single-hump wave. We call that monophasic. It's lost all its crispness, all its definition. And when you see that, it's a huge red flag that something bad is happening upstream.
Okay, so let's bring it back to our motorcyclist. What did the Doppler find when they put that probe on his leg and listened in?
The results were, wow, just dramatic and undeniable. Above the fracture, the waveform was perfect, beautifully triphasic, just what you want to see. But the second they moved the probe just past the break, the signal completely collapsed. It turned into that slow, sad, monophasic pattern. And all the while, his other leg, a perfect triphasic signal from top to bottom. That comparison told the entire story right there.
This image here really puts it all together. You can see that normal, sharp waveform before the injury, but look what happens after. The signal gets all damped and weak. That palpable pulse, it was a lie. There was just enough blood trickling through to make a little thump that you could feel, but the quality of the flow was critically, dangerously low. The Doppler found the truth that the simple physical exam totally missed.
Now, the Doppler itself isn't the final diagnosis. Think of it more like an incredibly powerful screening tool. Seeing those abnormal waves was a clear, unmistakable signal that something was seriously wrong, and that gave the doctors all the reason they needed to order the next test, a CT angiogram. That's a special kind of CT scan where they inject dye to get this super detailed 3D map of all the arteries.
And sure enough, the CTA confirmed it. The diagnosis? An intimal injury. It sounds subtle, but it can be absolutely devastating. It's basically a tear in the inner lining of the artery that creates this little flap, and that flap was acting like a valve, just blocking off most of the blood flow. A tiny tear causing a massive problem.
So, with that clear diagnosis in hand, the vascular surgeons get the call. And because the team caught it so early, before any tissue in the foot started to die, they were actually able to manage it without a big surgery. They just immobilized the leg and monitored him closely. And the outcome? A total success. The limb was saved. Just a fantastic result. And it all happened because that team was smart enough to look beyond that reassuring but misleading pulse. And really, this is the big takeaway here. Using a Doppler in a trauma situation, it isn't about patting yourself on the back and saying, everything's fine. Nope. It's about having a healthy dose of suspicion. It's about actively hunting for those hidden injuries that a physical exam can so easily miss. It's about preventing a complete catastrophe.
You know, it's such a powerful lesson, and it really goes beyond just medicine. It kind of makes you wonder, doesn't it? What other simple signs in our own lives, the things we take for granted as being normal, might actually be hiding a much deeper, more complicated story?